Welcome to the Doctor Lexi Show, where I take pregnancy topics and break them down into simple terms to help you advocate for yourself and your pregnancy. I'm Dr. Lexi, a board-certified OBGYN and maternal-fetal medicine specialist, which just means a high-risk pregnancy doctor. And today we have a really special guest on the podcast, Dr. Sarah Pachtman.
I also am a maternal-fetal medicine specialist. I practice obstetrics and high-risk obstetrics and maternal-fetal medicine.
I would love to talk some about board exams because we're talking about what we do as physicians, and I always like to hear the story of how people get to where they are. So I know all the exams that you went through, all the ones that I went through too. But for those listening to, give us an explanation of like when you actually tell us. I would love to know if and when you have a time where you're like, that's what I want to be. Like you knew you wanted to go into the world of helping pregnant individuals. So kind of how you knew, if you have a kind of a moment where you're like, this is what I want to do. And then just outline for us the steps that it took to get where you are now.
Good question and loaded one.
Lots of them.
Lots of it. So my mother was actually an obstetrician gynecologist, and she practiced here in Scottsdale, Arizona, Phoenix Mesa, Arizona. And she delivered at what is now Banner, like on Southern, and it's like way out in Mesa.
East Banner Desert.
Yes. Mm-hmm. What is now Banner Desert for my whole life. Like I was born her chief year of residency in June. And then she graduated at University of Michigan. And then I moved here when I was almost 2 years old. So that's all I ever knew. And I would go to rounds with her on the weekends. And
wait. You got to round with your mom?
Yeah.
You rounded in utero too. I mean, you were totally doing rounds when
I was in utero.
Yeah, that's cool.
And I would go and sit quietly under the nurse's desk and have cookies because, Banner has these really good sugar cookies. Those have been around I'm 42 years old. So they've been around for a long time. And I would have those and hang out with the nurses, and I would go sit in the corner nicely during a delivery. I didn't know, like in the 80s, that was kind of normal.
Yeah.
It's fine. Bring your kid to work.
Mm-hmm.
And that was my life growing up. Like when I was in high school, we had to do a science project, and mine involved birth control pills because why not?
That's awesome. Seriously?
Yeah.
Oh, that's great. Okay.
I always just had that.
Yeah.
So I went to medical school kind of being like, I'm going to do OBGYN, but I'm going to try to do something else just to see if I like something else. So I went to college for 4 years, and I actually did an engineering degree because I did engineering like band camp one summer in high school because I'm cool like that. Yeah. So I went to engineering college at Vanderbilt, and that's 4 years. And then I actually was like going to be a rebel without a cause. And I did a master's degree in engineering. It was a short amount of time. And then went to University of Kentucky for medical school. So that's another 4 years plus one for me in the middle. 1 or 2. Can't really remember. That's not a good sign. But okay.
They all blur together.
Yeah,
really
it's a lot of school. Finally, you graduate from medical school. And then I did a 4-year residency in obstetrics and gynecology. And I mean, I knew I was going to do OBGYN during my transplant surgery rotation in med school because the transplant surgeons at University of Kentucky are freaking amazing. And so are the CT surgeons. I mean, Kentucky has a lot of cardiovascular disease and a lot of farming accidents where people need organs or lose organs.
I never thought about that.
Yeah.
That's tragic.
It's a lot. Gosh. When I was...
So it's not like gunshot wound trauma stuff. It's more like tractors and...
Tractor trailers. Yeah. Or, when I was in med school, there was a pregnant patient, like 36 or 7 weeks in an ATV wreck. Because when you're pregnant, you ride ATVs because,
that's what you do on the weekends.
Right.
Yeah.
So, that would happen. And I did my trauma surgery rotation. I was like, this is so cool. Or my transplant surgery.
Transplant.
Because I got to ride on an airplane and go to like Ohio or something and pick up an organ in the middle of the night. And it was so awesome. And it was like, I was almost like famous. And then my mentor in med school is actually a CT surgeon. And I just thought I still do think he was just amazing. And the stuff that he did, it was like, oh, like, this is just so cool. But when I still went back and thought about it, even though I was like flying on airplanes to pick up organs, I was like, OBGYN is where my heart is. And that's where my life is. And that has been my life. My mother passed away when I was in high school. So I wanted to kind of finish her life's work also, because she was a soloist and she was so in love with OBGYN. It was her work and her craft. So I knew that I wanted to do that. And then I did a 4-year residency. And in my 3rd year of residency, it was like application time. And my mentor in residency really had a few, but were MFMs. And I was on this like really high risk antepartum service with some crazy stuff and difficult patients, learning so much. And I just like relished the time we took on rounds and how in depth we got with the patients. And I was like part of someone's life at their most vulnerable time. And I was like, this is what I'm doing. This is what I have to do. And the thinking and how complex it was. And it was just amazing. So I was like, I think I'm going to apply to MFM fellowship today.
Now, where was residency? Was it in not Kentucky?
No, I went
was
to
med school.
Kentucky Med School and then North Shore University Hospital, Long Island Jewish Medical Center combined OBGYN residency program. And I was the first year of the combined class. So there's 40 total residents. It's a huge system in New York. And between the two hospitals, I think there's almost 20,000 deliveries a year.
Oh my
Maybe
gosh.
something like 16,000 or
Wow.
17,000 deliveries.
Okay.
Yeah. So
you were busy. You learned a lot.
It was busy.
Lots of hands-on.
Lots of hands-on.
Okay.
And it's two very different patient populations. One is a hospital in Queens and the other is a hospital in North Shore of Long Island. But we were the tertiary referral center. So we just saw everything.
Yeah.
So then I did my 3-year MFM fellowship at the same place because my mentors were MFM and they were like, it's going to be great. Yes, it was very, very great. I had an amazing experience. Then finally, 7 years after you graduate from medical school, you're allowed to be a real doctor.
Yep. How long did it take for like your friends and I think your family, because your dad's a physician as well?
Yeah.
So I would say that's different. But like some of your friends that weren't in medicine, when did they actually, is that when they finally thought you were an actual doctor?
I think
like
so.
7 years later?
Yeah. They're like, wait, you're done with school, right? And I'm like, yes, I have been done with school.
Yeah.
I moonlight as the general OBGYN at this hospital in New York where I'm the only OBGYN doctor in the hospital. But sure, I'm done with school.
For sure, I'm done with school, yeah. Most of my friends always, when they look back at things we've done together, they're like, remember you were studying for that one test. Like that's how they mark life events, I guess you could say. And it was so long where there was always a test that we were studying for. You can just look at your career. And if you forget what year it is, go back to what exam you think you were taking at that time. Or like, what book did you have in front of you at the pool when everyone else was there for like a bachelorette party? And you're the one in the corner going, just give me like half an hour to look through USMLE or step 1, step 2, whatever it is. Like, that's how I feel like we have marked our lives.
Absolutely.
Which is insanity.
It's funny that you say that because my husband jokes around. He's like, you almost didn't come to our first date because you were making your board's case list. And
yeah, that's really important. You need to tell him
I'm like,
if you chose him over that, I mean, he must be an important guy.
And I'm like, the only reason I did show up is because it was already like 8 p.m. and my brain was fried for the day.
Yeah.
So
yeah, you had to stop. Okay. So for people, I love when people I don't want to say don't understand medicine. When you watch the TV shows like Grey's Anatomy, I feel like that's a big one that people go off of.
Yeah.
And since they had a character named Lexi, that was around the time when I was in residency or medical school and residency. So it was always like, oh, Lexi, like Grey's Anatomy. I was like, no, not really, but thanks. However, it is fun now when people ask what I do. Like, when you say maternal-fetal medicine, they're like, well, what is that? and then you say perinatology, and they're like, paleontology? No, no. And then you say high-risk pregnancy, and then they kind of start to get, oh, it's something with a pregnant individual. So sometimes I used to say, like Addison Shepherd.
Right. I
Because,
do what Addison does.
right? And that's when people are like, oh my God, that's really cool. And then they kind of get it a little bit.
Totally.
Although sometimes she wasn't doing stuff that is within our
She
scope.
was like also a pediatrician and also a
Yeah.
NICU doctor and also
Yeah.
like a lot
A
of other
general
things.
surgeon sometimes. I feel like she was like taking organs out and stuff. And I was like,
Yeah. She
if
did
you
like a
should be doing that.
splenectomy or something.
Yeah.
That doesn't,
No, we don't do
that.
those. No, we call in general surgery for that kind of stuff. We do not do that. But yeah, I still have friends that are like, so you deliver babies every day? No. You look at vaginas every day? No,
definitely not.
definitely don't do that. So it's the delineation is hilarious. Okay, so for the test, when you talk about making a case list, for anyone listening who doesn't know much about what we do, I'm gonna give a quick run through and then let you expand on this. So after medical school, so just imagine that we've graduated medical school, so you got an MD behind your name or whatever, or DO, whichever one. And then it's the residency part that we do. At the end of residency or during residency, there are a couple of exams. I'm going to bypass those, the USMLE ones. Those are med school
like
and
the
residency.
third part of the USMLE
Yeah.
because there's three
of them.
steps. It's a lot of steps.
So through med school and residency, it's USMLE step 1, 2, and 3 throughout. And then when you're finishing residency for OBGYN, basically right after you graduate, like the week you graduate from OBGYN residency, you can take your written OBGYN exam. So that's the first one. Then you have to have at least a year of cases to do the OBGYN oral examination. Then if you choose to do fellowship like we did.
Got chills.
I know.
Horrible.
Nobody wants to think about us.
Horrible.
And then you do another written exam for maternal-fetal medicine, and you have to have completed your maternal-fetal medicine fellowship, which is 3 years. Then after that is one more exam, which is another oral exam for maternal-fetal medicine. So there's 4 exams, 2 writtens, 2 orals to do what we do. And when she's mentioning this case list, explain to us what that is a little bit, because the amount of work that goes into this is huge. And I think when people hear, a doctor exam, a board exam, an oral board exam, they really go to that Grey's Anatomy where they're sitting in a hotel room and like they're throwing up and they're freaking out. And it's kind of like that. We're just not in a hotel room anymore, thank goodness. And that was true that they used to do that.
I'm glad we're not.
Yeah.
Because that would be
even more
awkward.
traumatizing.
Right.
Yeah.
But making a case list. So for my general OBGYN boards, I had to do, there's 3 sections and each requires like at least 40 patients or 20 patients or something like this. See, I'm so traumatized. I have selective amnesia.
We make it go away. We just, it's very psychologically traumatizing people. If you're listening and you've taken one, if you haven't, you never want to. So.
Yeah, you don't want to.
Yeah.
But so you have to keep record of all of the patients that you see, both in the office or in your clinic, that you operate on or that you deliver, or a combination of. And we make this list. It's like an Excel spreadsheet, but scarier, that has no identifying information, but their age, their G's and P's, which is how many times they've been pregnant and how many deliveries they've had, and issues, and if you delivered them, what the delivery issues were, and then your treatment for those issues.
And to make that even more annoying, right? It's vague. So you can write whatever you want, and then you're like, well, what do I write? Do I put the exact treatment? Do I put the labs that they had before and after surgery? And to make it even worse, when we were doing it, when you say like an Excel sheet, then I had like a Word document. So you had to have a Word document, but it looks like an Excel spreadsheet on a Word document. And you had to fix the spacing.
To make it perfect.
Yes. And now you can enter it into a computer program and it prints that for you.
But the spacing is still screwy.
And if you're type A, like most physicians, you can't have the spacing be messed up. So you'll go back in and dot space or do whatever to make it look perfect. So making this list is not just putting the information somewhere. It's being really good with Word, Excel, spacing. It's ridiculous.
And there's different sections. So you have to have a certain number of patients who had preterm labor, and they change every year. Do you know that this year, I think there's like an LGBTQ plus section? We didn't have that yet.
Yeah, we didn't have that on ours either. Yeah.
So there's a section for a substance use patient. There's a section for if someone had fetal macrosomia, if they had C-sections, if the office section, office is the worst for
Awful.
me.
Me too.
Personally.
Me too.
If somebody had menopause, I am maternal-fetal medicine. I don't do menopause. Oh my God.
Mhm.
Yeah, it's a lot.
Yeah.
And so you have to dig through your records, find the patients that fit into these categories. And they also, by the way, since there are patients, have 1,000 other things going on. So then you're like, do I include that? Even though it's not part of the section, but I kind of need the information.
Mhm.
It was just so
It's
stressful.
too much. And a lot of people that are taking the general OBGYN oral exam, like you were saying, are now in a subspecialty. And for us, it was maternal fetal medicine, but you may be subspecialized in urogynecology or reproductive endocrinology and infertility. And then you haven't done all the other stuff for 2, 3 years.
Right.
But yet you're having to sit for an exam like you just did it yesterday.
Right.
It's very challenging.
To say the least.
To say that? It's challenging.
And then you fly to Dallas.
Oh, yeah, that part.
Dallas, Texas, and you stay at the same hotel as everybody else who are pacing the halls, some throwing up. And they have a really good burger at that restaurant also. And it's like Christmas time too, by the way. And you get the day that you're going to go like a few weeks before. So you just drop your life and go.
Yeah, there's like, hey, the exam's going to be in one of these 2 or 3 months, but we won't tell you the week of your exam until later. And then we'll tell you the day of the exam when it gets closer. So imagine trying to balance, you're probably in a new job somewhere or a new fellowship or something when you're taking the general oral exam. You're doing all of these things and no one else, I think, really understands this because usually normal people will finish going to college or high school or whatever, and then they start a job and they commit to that job.
Right.
And that's what they do. Whereas we are like continuing this educational journey for forever. And in the midst of it, taking these exams and the people we're working for, which are hospital systems or academic centers or whatever, needing to take off. But they're like, well, you can't take off to study for that exam, but you need to pass the exam. And then you can't take off to go take the exam because we need you here to take care of patients. But
what?
It's just like, it's a mental mind game in so many ways. And that's not even getting to the fact that the material on it is challenging, right? So that's a whole second layer to that. It's insanity. It's insanity. So, as far as for boards, I've told my story quite a few times to people, but I unfortunately have failed a board exam in the past, which was traumatizing for me in the midst of all the things.
But to be fair to yourself, maybe it was the unmarked van that they made you sit in before and the unmarked location that they put us like some random building in Dallas. I'm like, where am I right now?
Maybe those things,
Yeah.
And I will say too, the level of what is the best way to say it? During the oral exams, they can ask you whatever they want.
Right.
So it gets a little unfair when you don't get past your first case. And it was a gynecologic oncology case you did in residency, but it's the only one you could find to put on your list. And it was a leiomyosarcoma. Bad choice on my part to put that as case number 1. But I thought I was doing the right thing, right? Anyway. So those things happen. And you got to I learned from that, which I think when crappy stuff happens, you can be down in the dumps about it forever, or you can have your moment to wallow and then move forward and try to make something positive out of it.
And so then that's how I ended up meeting you because I saw you at the first year fellow. What was it? The retreat. And I was like, oh my God, she's so cool. She's like, I wonder if she'd be friends with me one day. I don't even know. Like,
and now we're friends.
I was like, but just standing in front of like, oh my God. And then it was time to take my MFM oral board exam and make my case list. And you were doing board prep. So I took your board prep. And that's why I passed 100%.
Did I make it fun? I think I remember telling people, like, we're going to make it to where it's going to be enjoyable.
Right.
I mean, I think was it more, I
It
don't want
was
to say it was
more
fun,
enjoyable.
more enjoyable.
For
Yeah.
sure. I was still like, great, I have to go back. I didn't have to get in the unmarked van the second time. You want to know why?
Why?
Because I was 2020 board cycle canceled.
Oh.
And so I did 2021. And remember, we were board prepping for like a really long time, like an obnoxiously long time.
Yeah.
And it was Zoom.
It was Zoom. You were the Zoom one.
I was the
That's
Zoom.
Right. You didn't have to get in the van again.
I didn't have to get in the unmarked van.
You know what I've heard recently? They're making them Uber to and fro.
Okay, that might be better.
That might be better.
At least you can like know. Like I was like, what is this?
Yeah.
That van just stands out for me for some reason.
It was very, very strange. And you do sometimes feel like you're going to be on an episode of a really creepy TV show or something that's coming out on Netflix where it's like,
you've been punked.
40 doctors get in a van. They think they're going to take their exam. What they don't know. And guys, they take you don't have your phone. You can't have anything with you. Like, I mean, there are also people who are pregnant and taking this exam. And like, some people go into labor. Some people are breastfeeding and they're like, what am I supposed to do? It's 3 hours, by the way. Like, what am I supposed to do for 3 hours? Some people are diabetic and like, you don't get snacks. Like, I mean, I had a really bad cold during one of mine too. And there was I took cough drops in and they allowed that. But I mean, it was a snot fest. It was awful. And and
it's only 3 hours. It seems like 300 hours.
It's long.
And so that's how we met. We did my board prep and it was actually so fun because I had cases on my case list that you'd go through with me and we'd talk about them. And I'd be like, I don't actually have any, like, help. And it made it little ways to remember things and just boosted my confidence so much. And I had some very important, high profile and scary board examiners. Yeah.
They're like, you don't know who you're going to get until the day of.
Right.
So.
And then that face pops up on the screen. You're like, I know you and everything you've ever published and done. And it's like, you're famous.
Yeah. The intimidation factor just comes so quickly. And that's what all the practicing was for. Right. Like, and I used to put on, like, I'd put on glasses and be a salty person. I'd take the glasses off and put my hair up and be like a little bit more like super friendly. And like, you have to stay the same the whole time. You can't alter your answers or the way you deliver the news based on if they're aggressive or if they're overly friendly. You got to just deliver the news.
Right. Just say it in an even tone, even keeled. Don't act like you're, about to pee your pants because you kind of are, but you don't want to let them know that.
Yep. It's a mental game. And I think that's part of when I talk to people about doing preparation for it and doing some type of coaching, it's not an exam you start a month or two before. It's not like 6 months is the time I always recommend because you've got to get into the mind frame of that and also work on erasing this whole, throwing up outside the room and being so nervous and so like angsty and make it to where, I'm going to be really good at this and having that confidence behind it. And that takes time.
And what you told me is this, this is what you do and talk about every single day. Talk to me like you're talking to a patient. Talk to me like you're explaining what the patient has to the patient.
Yep.
You know this information. And when you come at it that way, you're like, yes, I do actually. I am actually an expert in pregnancy. So here we are.
Yep. Well, if you were to give a young OB resident any advice for boards, whether it was for OB or for MFM, what would you tell them?
To sign up for your course.
Start early too. Yeah, right? Like, I mean, I think it's hard to remember that. I think we forget. And what about as far as like branching from board exams to being like working while taking board exams? Did you find it challenging to talk to your mentors at work or the people at work to say, hey, I need time off? Or did you find it hard to talk to the people you're working with / for in training?
So I'm lucky. I did not have that problem so much because I worked with the same people that I grew up with, basically. So but I could see how that could be a huge barrier and create a lot of anxiety, especially if you're in a new job. Yeah. And you're like, I already need to take time off and need time to study. And a lot of people are studying after they've worked an 8-hour or 10-hour day. And your brain is already used up, or on the weekends, and then you never really get a break. But I luckily had a very supportive crew behind me to help me have the time and take the time, go study, or I'll cover this for you so you can study. And even if you don't get me back later, it's fine.
Yeah.
So
Just having that. Yeah.
I was lucky in that.
Good. And I think, you would think that programs would be understanding because they know what you have to go through to get to the next step.
Right.
But it just sometimes feels like there's pushback on that. And that's
Totally.
Yeah.
And I could see how other people who are new in my program are afraid to ask for extra time to study because they don't want to be like, it's the same thing in all of medicine. You don't want to be weak. You don't want to be an inconvenience.
Yep.
Studying for your boards is not inconveniencing anyone else. It's making you like around your board time. You are the most knowledgeable about up-to-date medicine and evidence-based medicine right then than you will ever be. So
100%.
it's actually convenient for me that you're studying for your boards because then can you tell me some stuff?
Right. You are the smartest at that point in time.
Yes.
110%.
Yeah.
So true. I want to touch a little bit on burnout just because I know that the career path in which we've chosen, it took a long time to get here. A lot of studying, a lot of exams, a lot of moving around the country and all that kind of stuff. How do you deal with being a spouse, being a mom, being a doctor, being a teacher, and then, trying to just like be yourself amongst all of that? How do you do it?
It's really difficult. It's really hard. I will say that I have times where I'm irritable a lot and anxious a lot because it's like my plate is more full than I would like it to be right now. And there's times when I have to say, all I can do right now is be a spouse, a mom, and a doctor who sees patients. I can't do extra things like I'll have to stop my Instagram for a week or two. I'll have to say, no, I really appreciate your invitation to this committee, but I just can't do it. I have to create space and time for myself to exercise and make sure I get my whatever self-care appointments in because burnout or whatever the word that we're using for it now is so real and so strong. And I don't even know. People are like, do you drink Red Bulls? How do you get your energy? I'm like, some half of it's fake, honestly. It's comes from I don't know where, but it's really hard.
Yeah.
It's a lot. It's a lot.
Yeah. Well, I think we're all working on it. I know I am every day just to kind of keep your head above water. Sometimes the treading that's going on below water, I think that a lot of people don't see it. So trying to almost even verbalize that to people has helped me. Like, hey, like you said, turning stuff down and being able to say no is not a weakness. And I think in our field, so many things when you don't visibly look like you're about to like have a mental breakdown, people are like, oh, you have so much extra time. I'm going to throw this on you, right?
Right.
It doesn't need to be that way. And I think that making changes, which when I made a change in a job, there was a little bit of the fear from my end of I'm going to be looked at as a quitter. And it was like a shameful thing of like, you don't leave a job that you just don't leave a job, right? Like you keep working and you keep pushing and you stay at one place and you just make it happen. And I don't know, that shame I felt or whatever went away really quickly when I was like, this isn't my story. I'm not going to be a victim to people being angry at me for choosing to help more patients.
Right.
Treat them in a really nice fashion. And oh, by the way, take care of myself from a physical and mental standpoint to be in a great place to continue to provide good care.
Totally.
Right.
It's something that I learned maybe this year. It's been a few months into my no journey where I realized, I said, look, everything that I'm saying yes to actually means that I'm saying no to two different other things because I am only one person and I can't physically mentally, emotionally, because of this thing that's weird. It's a physical thing called time, do all of these things. So I have to say what brings me joy, what is helpful, what is part of my job, what is part of my choice, and do those and not do the other things. And that's okay.
Yep, absolutely.
And it's so hard to say no because we've been conditioned to say yes, and not quit. But sometimes that's actually the best thing.
Yeah. And it's good, I think. And have you ever heard of Brene Brown?
Yes.
Okay.
And her podcast.
And her,
so yes.
so good.
So good.
I think I've tried this for forever. Like every time I talk with someone about Brene Brown, I'm always like, "Hi, Brene."
Yeah.
Because one day
listen to us.
that's my like, you know how people used to say like, if you could meet someone living or dead, like who would those people be or whatever? And
You
she's
would
like,
want Brene Brown.
yeah,
Cool.
her and the Maya Angelou for the
Yeah.
those are my two of my favorite peoples, I would say. But I think you hit the nail on the head the way you said it. It makes sense. It resonates, and I like the no journey. That's kind of a cool way to
I'm
put
on a
it
no
too.
journey right now.
I need to start that. I'm going to start that myself.
It's a good thing to do.
It's good. I like it. It's like the movie with Jim Carrey where it's like, yes, man, but it's like, ours is going to be no, man.
Yeah.
No, ma'am. Either one. Fine.
And I'm just like, I just know is a complete sentence and that's it.
Yes. I mean, no. I mean, yes.
Yeah. Totally.
Well, thank you for being here today.
Thank you so much for having me. It was such an honor. And I'm so excited to get to see you and talk with you. It was just amazing.
Thank you. And for anybody listening, if you're wanting any more information on board exams or anything, you can always go to the website, drlexihill.com. And if you're pregnant and wanting any more information on how to advocate for yourself, tons of resources for you on YouTube, on Spotify, all the little fun things, social medias, etc. Can you give us real quick your Instagram handle and all that stuff so that I can send people your direction, please?
Sure, definitely. My Instagram handle is Healthy Mama Doc. It's Healthy MAMA Doc. And I use my platform to entertain and educate and empower pregnant and people who are postpartum and people who want to be pregnant. And I love it. It's my passion project turned passion life.
I love it. It's so fun. Well, thank you guys for listening today. And as always, I'm Dr. Lexi, wishing you a happy and healthy pregnancy.